Hello all, and welcome to episode number 7 of Zach's Tech Talk Tuesday. My name is Ryan McQueeney. I'm a content writer here at Zach's. And as a reminder, Tech Talk Tuesday is our exclusive show for all of our tech-focused investors out there. This week, we're going to tackle a corner of the tech world that we've yet to talk about on this show, medical technology. I've mentioned the world-changing potential of several of the emerging trends we've covered on Tech Talk Tuesday, but medical technology can be even more exciting because it directly relates to saving and improving lives. Another thing I love about medical technology is that it tends to be non-discriminatory. If you look at the industry, some of the most exciting innovation is coming from amazing, talented people who simply want to help others that don't currently have the most efficient care. Last week, I had the privilege of attending MedCity Invest, which is a national healthcare investing conference hosted by MedCity Invest and the Mid-America Healthcare Investors Network. This investing conference took place right here in downtown Chicago, and over the course of 2 days, I had a chance to soak in some of the hottest trends in med tech. I won't be touching on everything I heard at MedCity, but I did want to highlight some of the things that stuck out to me. First, I wanted to talk about the opening keynote, which was delivered by Dr. David Rhew, the Chief Medical Officer at Samsung America. And yes, that might be surprising that Samsung Electronics has a Chief Medical Officer, but for those who didn't know, Samsung is really actively engaging in the medtech world and partnering with healthcare providers, doing studies, working on new, interesting medtech digital health solutions. I wanted to highlight one of those. A really cool thing that Dr. Rhew mentioned was Samsung's partnership with Cedars-Sinai Medical Center and a recent virtual reality-based study that the pair conducted. Basically, the study looked at treating pain and anxiety with VR therapy. So patients with pain issues and anxiety were given a VR headset to wear and then immersed in different scenes, including a picturesque tour of Iceland, an art studio where the patients could actually create artwork, and a soothing underwater ocean scene. Those are just 3 of the examples that I personally thought looked cool in the virtual reality clips they were showing. The study found that these patients would feel relief for 2 to 12 hours after the therapy. So after removing the VR headset, finishing the session, that relief lasted for 2 to up to 12 hours. And had the ability to reduce pain by 24% and anxiety by 60%. So they're seeing real results here. Dr. Rhew also pointed out that VR is useful for communication and medical training purposes. Those might be a little bit more obvious, using VR to help patients connect with and communicate with their doctors or their families if they're in a hospital or something where they can't talk to their families all the time. And then medical training, that one seems even more obvious, unlocking tons of potential as far as simulation for doctors and surgeons, being able to put yourselves in simulated environments that might be similar to what you run into with real patients. But Dr. Rhew said that this pain treatment study that they were doing was notably exciting because, quote, "we are starting to realize that this can be dosed like medication." End quote. So that's what I think was fascinating to me, is that we're talking about prescribing VR therapy to a pain patient. It's really, really awesome stuff. Kind of moving on to another world here, I wanted to highlight an interesting panel discussion that featured representatives from several major investing and VC firms that were engaged in medtech investing. The panel focused on unlocking value in digital health. So when we say digital health, think wearable tech that connects to a mobile application that tracks your heart rate or your eating behavior, or a sleep monitoring app could be an example. Maybe a web application that helps you book appointments. Maybe a website that helps you with diagnosis and treatment. It's a vaguely defined term, but these kind of using digital technology to improve health and to treat patients, connect patients with doctors, anything in this kind of world could be considered digital health. This space has really exploded over the last several years, but as healthcare technology continues to advance, more and more investors have been left wondering where to find the best value in this digital health space. So overall, this conversation seemed to focus primarily on promoting efficiency, quality of care, and collaboration throughout the digital health market. And there was also plenty of advice given to those looking to find value in quality in the busy world of digital health. I think really the takeaway here was the optimism. Last year, the new head of the American Medical Association likened the massive amount of digital health applications, startups, and just raw ideas to that of snake oil salesmen, which was a comment that really struck a lot of chords throughout the market, because for digital health for such a long time has been viewed as, this really innovative, awesome industry with a potential to do a lot of beneficial things for people. And then you have the head of the American Medical Association saying it's snake oil. So a head scratcher for some, but as the panel acknowledged, Critical Eye is smart here. A lot of these applications, I remember one of the panel members said, in an effort to kind of prove what the American Medical Association chief was talking about, he, before the panel, had gone on the App Store and Googled, or I just used Google as a verb that when not in referencing Google, but searched for something in the App Store. He just searched blood pressure monitor or something like that. And one of the first results was an application that claimed to be able to gauge your blood pressure by you pressing on the camera on the back of your phone, which is clearly not it. That's a fake app that doesn't work. So that was kind of his example of this is what the head of the AMA was talking about. The panel kind of refuted the claim overall, though. And like I said, they noted that a critical eye is important and that quality, above all things, is important for investors who are interested in digital health. But the panel seemed to take a more optimistic approach to it. So yeah, in my opinion, there's plenty of positivity in this panel, and that these emerging technologies, a kind of an overall sentiment that some of these emerging technologies will do a lot of good if executed correctly. So lastly, I wanted to highlight some of the cool startup companies that I learned about. A little bit less relevant for our listeners, our Zacks listeners who are interested in stocks and publicly traded companies, but a kind of cool way to gauge trends at the really macro level. MedCity News was hosting a startup pitching competition that brought entrepreneurs in from around the country. And while I only made it to a fraction of the total number of pitches, there were dozens over the 2 days. It crossed tons of different markets and industries. I thought some of the more med tech-like companies were cool, and I thought the listeners out there for Tech Talk Tuesday would enjoy hearing about them. So for one, I encourage you guys to go check out Roundup. The company is basically the Uber of medical transportation. Not to make a really cheap comparison there, but they actually describe themselves as the Lyft of medical transportation because they had, in fact, partnered with Lyft. But in a sense, the idea is the same. There's a mobile and web application for booking trips for non-emergency medical transportation. In the pitch, talked a lot about the current inefficiencies in this little market and how the kind of all-in-one nature of their platform helped to solve some of these inefficiencies at an affordable cost. Another cool company I noticed was Lucro, which, again, to make another kind of cheap comparison, if you will, it's basically the Pinterest of health solutions. The company created a platform that connects healthcare buyers, like hospitals and large medical systems, to providers of innovative healthcare products. So how it works is, like Pinterest, a buyer can create a board and kind of pin these needs or demands or problems that they're having to that board. And then the solutions people come in and can view boards and respond to those boards with pitches for their solutions. So these two, in reality, were just the tip of the iceberg at MedCity Invest. And as I said, there were dozens of other innovative startups that thought they had the next great solution to the age-old questions that we're facing in healthcare. And that's really my takeaway here, and I think that should be my takeaway. That would be what I would suggest as a takeaway for those who didn't attend. The questions that are being asked have not changed. The sector is still primarily focused on creating efficient health outcomes, helping people who are sick, obviously, helping people prepare and prevent themselves from getting sick, and doing it all at an affordable cost. That's been the goal of the entire healthcare sector forever, or at least it should be. Today, what's happening with medical technologies, we're just finding new ways of answering those questions, of achieving those goals. So that's my takeaway, but I do want to hear from you. What do you guys think about med tech? Have you seen any interesting new ideas that I haven't heard of? Or do you have a different story you'd like me to cover on the next Tech Talk Tuesday? Shoot me an email at podcast@zax.com. You can also check out all of our other exclusive audio content at zax.com/podcasts. Please remember to subscribe and leave us a rating on Apple Podcasts. It really helps out. Thanks again for joining us. We will see you next time on Tech Talk Tuesday.